Tired of the conflicting advice in the world of health and wellness? Ready for clear, science-backed strategies to live a longer, healthier life? Welcome to the Duration Wellness Show. We focus on health and wellness education to help you become a better, more informed you. Wherever you are on your journey, we're here with you for the duration.
All right. Well, welcome to the Duration Wellness Show. I am Dr. Anna Marie. I am a board-certified internal medicine physician, also with a master's in public health with a love for preventative medicine. And our guest today is Dr. McCarthy, a board-certified internal medicine physician with decades of experience and still volunteering at the City Rescue Mission. So still working and really has been ahead of the game on integrative medicine, with her medical practice. And we are continuing our series on gut health, which has been so great. So welcome back.
Oh, thank you.
And then,
Good to be back.
and then I don't know if you want to do just kind of a brief overview, this way people can kind of listen to the series out of order if they want.
Yeah. Well, basically, we kind of laid the foundation in the first series of gut health and the definitions and some of the discussions on the value of probiotics and prebiotics and postbiotics, and having a healthy diet leads to a healthy gut, which leads to a healthy life. And then we went over some of the toxins that are in our environment and that they are increasing in number and concentration. And the few of them that we did go over were just even cleaning products with triclosan, the pesticides and sprays on golf courses and on our lawns and Roundup. We're going to be discussing in this series, which is glyphosate. But there are so many toxins we reviewed, and we tried to go over how to best eliminate the toxin exposure and eliminate the toxins once they are in our body. So because they, as we went over last time, are a trigger for autoimmune diseases, inflammatory bowel diseases, cancer. I mean, the list goes on, and even like we studied last time, Parkinson's disease. And so if we can try to limit the exposure and get rid of the toxins as best we can, then we have a good chance of having. We also went over the antibiotics, that our antibiotics are kill not only good bacteria, but bad bacteria, not only bad bacteria, but good bacteria, and the effects of antibiotics, especially the fluoroquinolones and clindamycin, can be so detrimental to your gut health and causing leaky gut, and the negative effects can extend out to years post having that antibiotic. So we tried to go over how to minimize exposure and accumulation of microplastics and nanoplastics, and trying to just do simple things with changing your cooking ware. And I mentioned changing my electric toothbrush that has the castor oil bean bristles instead of nylon or plastics, and my coffee maker that has no plastics in it at all, especially the black plastic, which you mentioned as being horrible.
Yep.
And then we went over this little study they had with having foods that have C3G in them. That's the colorant in fruits and flowers that makes that purple color or blue color in your fruits and vegetables. And that product, this anthocyanin, C3G, actually acts like a sponge to absorb the microplastic, and then you can have it excreted out of your body and have less accumulation of your body. And along with, we know also some of the microplastics from infrared sauna, and that also helps, and exercise and sweating and all that.
Yeah, sweating, all that helps. So
yeah,
and then again, high fiber diet, right? Because it helps coat the intestines, all of that. So,
and kimchi. That was the last thing.
Yep.
That was the one that really acts even more so like a sponge to take in the microplastics. So, and those foods with the C3G anthocyanin foods, those are your wild blueberries, purple sweet potatoes, black rice, red cabbage, your berries, purple corn.
Yeah, so just think purple, basically. Is
Purple,
always what I
yeah,
say.
and
That's
blue.
pretty easy to remember.
Yeah.
So I thought next we'd kind of talk, because we have discussed it a little bit, but I know there's so much more information about glycophosphates, because
Yes.
I think there's a fair amount of people that understand that like glycophosphates are bad, but there is also, I think, a lot of people that still say, no, you're overreading glycophosphates. It's not as bad as you think. And
Oh boy.
so I think,
Yeah.
let's talk about specifically glycophosphate and the gut.
Yes. So glycophosphate can definitely harm the gut, mainly by disrupting this healthy microbiome and weakening, again, the intestinal barrier, the lining of your gut. So research summaries indicate that it can also alter gut bacterial balance. And so it basically reduces the beneficial bacteria and promotes the bad bacteria. And that affects our digestion, causes inflammation, and immune signaling is off. So there are main ways that it affects the gut, and they are basically inhibiting the bacteria that have a metabolic route present. There's a metabolic route present in many bacteria, but not in human cells, which may shift the microbial community away from beneficial species. So having exposure to glycophosphate shifts it to the microbial community being the bad guys, okay? And then it may increase gut dysbiosis, having that unhealthy balance, right? And reduce the intestinal barrier integrity by affecting the mucus secretion and microvilli. Those are little hair-like projections on the sides of your intestinal tract that absorb your food and have that proper digestion function. And so it can make, again, there seems to be a constant theme with these toxins that it affects the gut lining integrity, causes leaky gut, and causes easier for inflammatory triggers to cross over into your bloodstream. And that causes more inflammation throughout your body. And so we know it can also change these gut-brain signaling. Remember, we went over the gut-brain axis. And it can affect the gut-brain signaling molecules, which could influence your appetite, your immunity, your moods, and metabolic regulation. So glycophosphate, remember, that is what is in Roundup. I really think we should go back to do not spray your lawn. Let it have some weeds. Let it have some healthy bacteria in it.
Yeah.
Get rid of Roundup. Don't use it at all. And trying to endorse more regenerative farming rather than these heavily sprayed farms and crops that are, because not only do they spray the crops for to guard against insects, but also they use it as a desiccant before they harvest the crops as a drying agent. And so it's loaded with this horrible I call it poison at this point.
I know. And that's something that I will say, as I learned more about this, kind of shocked me, is the whole, that it's like basically dry spraying them. And so there are certain crops where it's really high in terms of the glycophosphate exposure because of this dry spraying. Which is just
they can
so
use
sad.
other drying agents that are safe.
They can. But I do think that there is a lot of times people talk about big pharma and big medicine and everything. Well, this glycophosphate spraying is
very lucrative.
Worse and more, in my opinion, because it's a money-making machine. And so I think a lot of the health effects and detrimental effects that it has are overlooked. And I think that they try to downplay a lot of the dangers with it because of that, which is really sad.
It is. So, just as a little aside, when I was taking my walk on our break here, I just heard on the radio that a very big company that makes athletic wear, big company, has finally phased out PFAs, the polyfluoroalkyl, the forever chemicals, from their water-resistant products. So that's good news. Gradually, it's like you said, it will take time. So I'm hoping it will be true for glycophosphate exposure in our food and water. Trying to get clean sources and just wash and prepping food and try to minimize your environmental contact to this. And I would say always go organic when you're buying your oats, your wheat-based, because oats can be high in glycophosphate concentration. Your wheat-based products, leafy greens, potatoes, berries, because certified organic farming prohibits this glyphosate use. And it shows after these people that ingest this type of glyphosate-free foods have a big drop in their urinary glyphosate concentration when they switch to these organic diets.
Yeah. And I think that's where also not everybody, right, is in the financial spot where they can eat all organic. And so that's where I think sometimes educating people on, well, what are the foods that have the highest amount of, glycophosphates in them, and what's the hardest to wash off? So if you think about getting oats, it's dry, right? So you can't really wash them off. And then plus on top of that, if they're doing this dry spraying, so they're getting this double hit of the glycophosphates, then that would be, one of those areas where you say, hey, I really need to try to get organic for the wheat and for, the oats, because that level is so high and I can't rinse them, right? And then it might be where, hey, I wish I could afford organic blueberries, but I really can't. But sometimes frozen is a lot cheaper and you can still get organic.
Yeah.
Or if you get, unorganic, then you can try to wash them and soak them in, baking soda to at least decrease the amount that's on them. So at least taking steps, there are, if you can't afford all organic, there are other steps you can do to still try to decrease your exposure.
Yeah, that 1 to 2 teaspoons of baking soda in water for 10 to 15 minutes really did that baking soda remove a lot of these toxins. And as you mentioned also, the peeling of some of these vegetables and fruits, and wash and scrub as best you can and do as best you can. But there are some safe things that are inexpensive that you can do. And of course, always limit processed foods and glyphosate treated grains as best you can. And that's in a lot of our cereals and snacks, right? Choose these non-GMO or glyphosate. Glyphosate is also the same thing. Glyphosate residue-free certified products whenever available, because then they're less likely to have any of this contaminant, at least. And grass-fed or pasteurized meats and eggs, choose that over the other conventional fed animals. Since many of these industrial feeding crops that they give to these non-free range animals are glyphosate treated crops with residues, and then it accumulates the animal product, and then we eat the meat, and then we get it from that source too. And we mentioned this last time, getting a good filtration system, reverse osmosis or activated charcoal to remove glyphosate. If you live near a agricultural or heavily sprayed area, consider testing the water, And we know glyphosate is also aerosolized, so it's not just in your drinking water and what you ingest. But I would just, I think it's really, we're going to find out it has done so much harm, and it should just be totally outlawed, to be honest. But one interesting thing that I was reading is it is glyphosate, this horrible herbicide, pesticide, is an analog of the amino acid glycine. And remember, glycine is what you have in your sleep product.
Yeah.
It's a very good product to help you to sleep, and it's very good for your muscles. And this amino acid, it's very healthy to have it. So, and it attaches in places, glyphosate attaches in places where you need glycine. So, importantly, glycine is used up in the detoxification process. Hence, many of us do not have enough of the glycine for detoxification. So, one doctor came up with this way to eliminate glyphosate is to saturate your body with glycine. It's a benign supplement to take, and he had 1 teaspoon or 4 grams of glycine powder twice a day for a few weeks. Then you can lower the dose after that to just a fourth of a teaspoon twice a day. But anyway, this glycine forced the glyphosate out of your system and then allowing it to be eliminated through your urine.
Yeah, that's awesome. I mean, glycine is so important for so many reasons, but there's been a lot of evidence in terms of how it helps with sleep, which is why at Duration Wellness, we, developed Sleep Club, and it has glycine as one of its big parts. And it really does help in terms of sleep, which also is really important, right? In detoxifying your brain, right? And then that in terms when you have good sleep, you're able to actually, your immune system can function better. You can detoxify better, decrease inflammation.
Yeah.
Sleep is so important in that process. So it's really, I think, also cool to see that it helps with, removing some of the glycophosphates. I think that's very cool.
Yeah, even I would bump it up now. I'm taking 2 grams, 2,000 milligram of the glyphosate. And then the other thing is, this glyphosate is also a chelating agent. That means it chelates or binds out a lot of our minerals, trace minerals that are in food. And then, because it binds to glyphosate, those minerals are no longer available for us to absorb. So it basically is a way of depleting our trace minerals. But there is one exception. There's one mineral, aluminum, which it binds aluminum and takes it across glyphosate, takes aluminum across the gut wall into the tissues. So that's, we'll go into aluminum in a minute here. But
Yeah.
another way, as we know, is sulforaphanes in broccoli sprouts. And
Yeah.
I take the Abmacol, which is a good sulforaphane supplement.
Yeah.
Infrared sauna, we already mentioned.
And just to go back to the sulforaphane so that people know, it kind of supports your body's own detoxification system. So,
Yeah.
it really helps the liver in terms of, which is one of your body's biggest detoxifiers, kind of helps with all of the detoxification process and is so important. And so it's what is typically in a lot of cruciferous vegetables. So broccoli, cauliflower, and then when you look at the levels, what it's really high in are like the smaller, like the earlier versions. So like the broccoli sprouts, the cauliflower sprouts, things like that.
Yeah.
And a lot of people can make them at home for very cheaply. And anyway, very, very helpful.
Yes,
It's something
very good.
I know we have added into our own diet. We have them every week. All the time. I try to add them into literally everything.
And you can get them already pre-made. It's hard to grow it on your own. I have heard, well, it's not hard, but you have to be careful about contamination and
I
things
think,
like
and
that.
also you just have to have the time and stuff. But you can, there's a lot of micro growers who will, that you can buy them. There's stores that sell them now. And then, but a lot of people who are on a budget, you can make them very cheaply.
Yeah.
So I think also you just touched on aluminum.
Yes.
So let's talk about that, because I feel like a lot of people say aluminum's so bad, and then other people say, you're overplaying aluminum.
Well, we do know it has affected brain health. We do know that. But interesting, when I researched this, one common ailment related to aluminum toxicity is underactive thyroid. And so, but it's related also to the gut because aluminum, such as that found in antacids, actually interferes with intestinal absorption of thyroid hormones.
Oh.
And being a metal, it also has an affinity for the nervous system and tends to collect in our brain, our spinal cord, and the nervous system, the enteric nervous system of the gut. And in all these places, aluminum can then block vital functions in those areas of your body. So basically, one way to eliminate aluminum is to get rid of aluminum products, right? But also to increase your intake of silica. And that you can get by using silica-rich herbs like cilantro.
Which cilantro is great.
Again, it's a good detoxifier.
Nice fresh vegetables and seasoning. And so,
And then there's this a horsetail, also high in silica, and liposomal silica product called Biosil. So citric acid also has been shown to mobilize aluminum. And an easy, inexpensive strategy is to squeeze some lemon into a bottle of water and then just drink that every day, So that is also a very good way. Malic acid is in apple cider vinegar. I take a glass of apple cider vinegar every morning. That's another way to get out the aluminum. And so overall, there are these toxins, but there are some things that we can do to avoid exposure and have it excreted out of our body before it does some serious harm.
Yeah. And I also will say, we kind of talked about it for a little bit, but sauna, I'm a big proponent of sauna, and I do think that there's a lot of benefits that we're finding out. I think we're probably going to find out more and more that it helps, with microplastic exposure, trying to excrete the plastics and, even with the glycophosphates and everything, because your body really does try to remove these. And there's not great studies, but there have been like case reports of people measuring before and after. And then with the saunas, they really end up decreasing the exposure and the amount. So, which is exciting. So I think another topic that a lot of people probably have heard of and a lot of people probably don't understand is small intestinal bacterial overgrowth. which is also called SIBO. And now I think there's also a new one, which is small intestinal fungal overgrowth, which is SIFO. And that's really even more new. But I think a lot of people probably have at least heard of SIBO just because there's a lot of people who have that now.
Yes.
So I thought, in terms of gut health, that maybe we would kind of touch on SIBO and the small intestinal bacterial overgrowth, and then also the fungal overgrowth.
Yes, very good. It is, there isn't much on it, but now we're finding out more and more. SIBO, as Dr. McCarthy well said, stands for small intestinal bacterial overgrowth, and it's a condition where too many bacteria grow in the small intestine. Remember, we were talking mostly about colon, the large intestine, and your intestinal tract, but here SIBO is referring to overgrowth of bad bacteria in the small intestine. So you have your mouth, esophagus, stomach, and then your small bowel, your small intestine, and then your large intestines, the colon. So we are finding out the majority of people in the United States and eating this Western diet have some degree of SIBO, which is very sad. And we see that when you have developed this small intestinal bacterial overgrowth, you will have symptoms of bloating and gas and abdominal pain. You can have diarrhea, constipation, nutrient deficiencies. It can hinder your gut motility, slowing it down, and other digestive problems like we see in irritable bowel. And they let bacteria accumulate where they usually don't accumulate. They are accumulating these bad bacteria in large numbers in this part of your intestinal tract, the small bowel. A SIFO stands for small intestinal fungal overgrowth, and it's a condition in which an excessive amount of fungi, mostly Candida species, grows in the small intestine, and it too, just like SIBO, can cause a lot of serious digestive symptoms. And so small intestinal fungal overgrowth is a form of gut dysbiosis where the fungus overgrows in the small bowel. And by one common definition, they diagnose it by finding more than 1,000 fungal colony-forming units per ml in the small intestinal fluid. But again, it has the same symptoms as small intestinal bacterial overgrowth. A SIFO, fungal overgrowth, has bloating, gas, abdominal pain, diarrhea, nausea, and generally a general digestive discomfort after eating. Some people also report fatigue and oral thrush, which that is your white tongue and thrush fungus on the tongue. More frequent to have vaginal yeast infections, esophageal candidiasis, which is something we would see years ago in immunocompromised patients. They developed the fungus in the esophagus, very painful, right? We used to see in the HIV patients before we had proper treatments for that. And then it's just this feeling of brain fog, joint aches, just general malaise. And SIFO is less well studied than SIBO, and even the diagnosis and treatments are often, difficult there. So it's really empiric therapy based rather than a single standard test for that,
Okay.
So
what would you say would cause it? Because again, a lot of people have SIBO, and I think we're finding more and more about SIFO too. So, what causes it?
Well, SIBO usually happens when the small intestine's normal defenses break down, letting bacteria build up where they shouldn't. So common causes include patients that have slower gut movement, especially movement of food and contents of the stomach into the small bowel. In that area, when that movement is slow, then you will get this symptom that we see in diabetics can also develop gastroparesis, where that's a slowing of the emptying out of the stomach contents into the small bowel. GLP-1 agonists, I'm wondering now, and I haven't read anything about it, but they also slow and stall this gastroparesis state where it slows down the emptying of your stomach contents to the intestinal tract. Anything that causes that state can potentially cause SIBO and SIFO. Okay. So and the other thing is less stomach acid, which that really aids in growth of bad bacteria. So we know antacids can do that, especially proton pump inhibitors, where they reduce your stomach acid contents. These proton pump inhibitors like Prilosec, Acifex, Protonix, Nexium, they are all what we call PPIs, and they basically shut down your acid production in the stomach, and that then shuts down your body's defense to kill off bad bacteria that can harbor and stay in your small bowel, and bad fungal infections. So, that's another one. So basically, these slow gut movement, low stomach acid, structural problems in the intestinal tract that hinder the motility of your gut. And then, of course, there are certain diseases like celiac disease. That's that wheat allergy disease, if you will, gliadin reaction. Diabetes can do this. Again, I think that's because diabetics can often get autonomic nervous system dysfunction. And one of the autonomic nervous system function is to have that normal peristaltic movement. And that can be compromised in a diabetic. It also can be compromised in somebody with Crohn's disease or scleroderma, which is where you have connective tissue abnormalities, and that can hinder the normal motion and motility. And so then these bad bacteria, they don't get swept along effectively, and the fungus, and then they colonize in your small bowel. Other things like structural changes from adhesions from prior surgery, strictures, fistulas, and also immune or mucosal problems that make it easier for these bad bacteria to persist. So,
which I think is probably, honestly, the majority. I mean, I just think of the number of people that I've seen with SIBO, and it's even more than people who have diabetes and celiacs. And it seems like or maybe it's just the population that I see, but it seems like almost half of them have SIBO. So
yes.
It is, I don't know, I would wonder just, briefly we had talked about, the vitamin B1, and constipation. It'd be really cool to see a study that would actually give this, to see if it helps, if it is some decreased motility, right?
Yes.
If like patients, one, to see if patients who have constipation have a higher rates of SIBO. And then two, if they do, if B1 helped with that. I'm just thinking that would be very interesting.
That would be a very good study because it would show that if you correct SIBO with a good gut health diet and that symptom resolved because you could measure the thiamine levels going up and the symptoms resolving, then you could say that is from a good gut microbiome producing the thiamine and then allowing this normal peristaltic wave to occur. Yeah, it's all we're going to find out connected, I believe. So, common other conditions, well, I already mentioned celiac, diabetes, scleroderma, connective tissue disorders, Crohn's, inflammatory bowel disease, and having bariatric surgery is also a risk factor. So SIFO, pretty much the same thing. Low stomach acid can cause small intestinal fungal overgrowth, impaired gut motility, dysbiosis from antibiotics, steroids, or other broad-spectrum drugs can wipe out protective bacteria, and then they cause the fungus to grow and proliferate. Weaken and suppressed immunity, such as we see in diabetes, HIV, cancer, autoimmune disease, immunosuppressant drugs, steroids. And then again, the same thing with structural changes after GI surgery, including colectomies and altered anatomy that promote stasis or a lack of flow and peristaltic motion. And then metabolic factors, very important. High sugar diets feed fungus, and then fungus really can grow if you're on a high sugar diet. Obesity and possibly some hormonal states can favor fungal overgrowth. But they basically very similar drivers of SIBO and SIFO. They're very similar. They coexist. And the management often targets motility, acid status, and microbial balance. So, yeah. But it's, something I think it's very important we're going to find out to correct.
No, I 100% agree. So, I think you kind of touched a little bit on, it can be difficult diagnosis-wise, but, how do people start if they're concerned about this? How is, SIBO is a little bit more understood, so diagnosis then is a little bit easier. But, how are these diagnosed?
Well, you want to get a good history, right, and get their symptoms and then order some specific tests that look for excess gas-producing bacteria in the small intestine, because these bad bacteria in your small intestine that cause small intestinal overgrowth, they are gas producing. So they produce hydrogen gas and methane gas. So that's why we have the breath test. I don't know if any of your audience has done a breath test, but you drink this sugar solution, glucose or lactulose, and then you breathe into this device at timed intervals, and a rapid rise of hydrogen or methane in your breath suggests that you do indeed have SIBO. So that's the most common non-invasive test. And you even can buy these at-home breath units called AIR, but they're not cheap.
Yeah.
They may come down in price, but anyway, you can get this covered by most insurance companies from your, doctor, breath test for SIBO. And then small intestine aspirates and cultures when you're doing an upper endoscopy and taking fluid, that might be used, but it's not as often used because that's so invasive. We have blood tests just to check for vitamin deficiencies, especially B12 and fat-soluble vitamins. They will be lower in level, or you'll have low blood protein levels from malabsorption due to SIBO. You can check for your stool to see if there's any fat malabsorption. Imaging, not so valuable unless you want to see structural. There's a rule out of structural problems there. But SIBO, really it's mainly through the breath test, and it's usually treated with three main goals: to reduce the bacterial overgrowth, right? The bad bacterial overgrowth, fix your nutritional deficiencies, and address the underlying cause of why this keeps coming back.
Yeah. And, I do think it's interesting to touch, which I'm sure we'll talk about a little bit more, but I think a lot of people who are diagnosed with SIBO, probably the testing for nutritional deficiencies can sometimes be missed. I think it's very easy to be like, hey, these are your symptoms. We think it could be this. Hey, we found that this is going on, so now we're going to treat it. But then maybe not realize that it could be these other deficiencies that started, which then can make your symptoms maybe not fully go away, even though you've treated the SIBO, because now you have nutritional
deficiencies. You still have nutrition.
Yeah. So I think
very good. And it also will be a confirmatory test that you have SIBO with the breath test.
Yeah. So I think that's just something for people to be aware of, to advocate for themselves too.
Yeah.
So and then I think,
it's interesting, just as a side, there is a Spectrasil nutritional test that you can do that gets all of these nutrients. It's big, but it's very helpful for people that have had SIBO for years.
Yeah, and so what she's talking about is, and there's actually a few companies that do this, but they basically go through micronutrients, and it's a very large panel, and it goes through all of these. Typically, they're not covered by insurance, but most of the time, if you, again, cost prohibitive, a lot of times if you talk to your doctor and you say, hey, I was diagnosed with SIBO, I am concerned, a lot of times you can get at least B12, vitamin D, certain vitamins
will be
like
covered,
that can get covered and can be ordered, even if it's not in a large lab like that.
Yeah. And then SIFO, the fungal, is diagnosed mainly by combining clinical symptoms, with some of these nutritional tests. But there's no single non-invasive standard tests yet for SIFO. Many clinicians will just have a working diagnosis based on the symptoms of SIFO. And they will notice that patients that give a history of having their bowel symptoms worsen after eating sugar, that's a clue. And especially if the patient is on antibiotics or PPIs. And so, with time, they'll have some more sophisticated tests. They're using PCR testing and blood and urine markers and candida antibody panels. But really, there's nothing gold standard out there yet.
I think it'll come, though. I mean, honestly, it's a very new and emerging thing that we're starting to understand.
Yes.
And I do think it explains there's a lot of people, I think, who, they get treated for SIBO, right? And then they improve for a while, and then they start having issues again, and then they're negative for SIBO. And, you do wonder if then it could be, this fungal overgrowth, right? And I think as we understand more, we'll probably end up having better tests to look into this. So I think that would be the next thing is, treatment. So, if somebody finds out, that they have small intestinal bacterial overgrowth or SIBO or this fungal overgrowth, the SIFO, how do they actually treat it?
Well, the antibiotics in traditional medicine, they will start with an antibiotic called rifaximin. It's what I use for traveler's diarrhea. It's pretty benign, doesn't have all those negative effects of real antibiotics, So I kind of look at it almost like a probiotic antibiotic. But anyway, rifaximin is the standard first-line therapy, and it's often used for 1 to 2 weeks to reduce this excess bacteria in your small intestine. And although around 50% of patients may respond to this treatment, SIBO often returns. Unless you're going to change your diet, SIBO is going to return. So, and for more complex patterns, especially the methane predominant bacteria, doctors may combine this rifaximin with another antibiotic called neomycin. Now, years ago, I used to give that for my patients with hepatic encephalopathy before rifaximin came along. And it's an antibiotic that's really not absorbed into the body, it just stays in that GI tract. And it was useful for lowering the ammonia level that we would see in patients with cirrhotic liver, cirrhosis of the liver that would produce high ammonia levels and have confusion. And that was something we called hepatic encephalopathy. So, but it's interesting that they will still use that for SIBO. But anyway, and then also, some providers still use herbal antimicrobials to, botanical blends that may help with some of this. But I believe that one of the most effective ways to correct SIBO and SIFO is to eliminate the triggers that cause it and to eat homemade yogurt, as discussed by Dr. Davis in his gut health book. So I will be discussing that in a little bit.
Yeah.
But I'll tell you, he's a brilliant physician, MD, cardiologist, who was in the early part of his career putting in stents and doing all of the typical things you do for cardiac health and the statin drugs and everything. But he still kept seeing patients that would have recurring arterial diseases, even when they took the traditional pharmaceuticals to help them correct their risk factors, and then came about the importance of gut health for cardiovascular health, for overall health. And one of the biggest areas that was not well studied was the SIBO and SIFO. So, but basically, I'll go over that a little bit in a little bit, but also what is recommended is in the short term are low FODMAP foods, but that's just going to reduce the gas production. It doesn't really do much.
Well, and I do want to go into that because I think that that's something that is often recommended and people don't understand the reasoning behind it. So the FODMAP diet is basically like a low fermentation sort of diet. And it does help because, the foods that it reduces are the ones that will kind of, they can have more, they can have more gas producing. But it really should only be temporary because being on that diet permanently actually removes a lot of very healthy foods that really have high fiber that are helpful for restoring your gut health overall. So when you're doing that, it really should be a bridge, to like then
2 to 4 weeks, they suggest. The longest is
and then as you reintroduce, some of these foods because again, we already talked about all the blue and purple foods like the purple sweet potatoes and the blueberries and how helpful they are. And so you don't want to have those cut, always, right?
Yeah.
So it's a temporary thing and then you reintroduce, more.
And then your nutrients and vitamins, like you said. Now, for SIFO, it's usually treated with antifungal layered approach plus dietary and lifestyle changes to reduce fungal load and correct the underlying gut health problems that let it develop. So these antifungal prescription drugs, the first line one is fluconazole or diflucan, which a lot of women are familiar with for yeast infections, vaginal yeast infections, or can use that nystatin because it mostly stays in the gut. That's why I kind of like that one. And then itraconazole or Sporanax are also other possibilities. And then there are some herbal antifungals that clinicians use, like oregano oil, berberine, which I love berberine because it helps with a lot of other problems with weight gain. It helps with your insulin resistance, your sugar metabolism, fatty liver. It's a natural GLP-1 agonist. So anyway, that is also one of the botanicals that you can take. Garlic, olive leaf, tea tree-based products, And then anti-candida or low sugar, low fermentable diet,
And
limiting that sugar,
just to go back to that, I'm curious. So is the olive leaf, would that include olive oil? Like if you're having olive oil, or is that separate?
It didn't say, it said olive leaf,
Yeah.
because it did say specifically oregano oil, not oregano. So I think it would be referring to the actual leaf.
Yeah. I mean, I just would be interested to
Yeah,
know
because it
because
probably has the fiber maybe, or
maybe, I don't know. I mean, also, again, we know that we talked earlier about how the Mediterranean diet is really one of the best diets for gut health. And that is
yes.
you know,
Yeah.
olive oil is a big part of that, right? And then garlic
Mhm.
that's in this list too. So you wonder if that's also just because this, again, would help decrease your SIFO risk there.
Yeah.
So I just was curious.
Yeah,
Sure about that.
yeah, I'm not either. There's some really interesting studies that can be done,
Yeah.
But also they suggest meal spacing. So you're leaving 3 to 4 hours between meals. And then also prokinetic agents that help you move the bowel along. Because remember, it's stasis of the food contents in the upper intestinal tract that cause this overgrowth. So some of the botanical prokinetic agents are artichokes and ginger. So that helps keeping your motility normal. And then, of course, we need to fix the root causes like the low stomach acid with PPIs. And that would be important to taper PPIs because you can get a rebound effect with your gastrin and your
Yeah, just
acid
stopping
production.
cold turkey. And
Yeah.
also, again, there are reasons that people are on antacid medications, it does decrease, if somebody has a very severe ulcer, right? Or if they have a precancerous esophagus because the
Barrett's.
acid, which is called
Yeah.
Barrett's, but it's
Mhm.
precancer changes because the acid has been so bad.
Mhm.
Those are the people where they do need those antacids. But I also think it's important for people to then know prevention, what they can do, right? Like, hey, if you're drinking, stop drinking because that's going to make it all worse. So, if you stop drinking, then maybe you're actually going to be able to get off of your PPI because that was exacerbating the problem. And,
Yeah.
also
True.
the not eating late at night and sitting up and all of the reflux precautions. So
Mhm.
I think there's a lot of things where people can sometimes make some changes so that they can be at least weaned off or on a decreased dose of those
Yes,
medicines,
yes.
which
Um,
is good to think of.
and they suggested here bitters. They support your digestion too. And in another article I read about papaya, papain. So there are some other naturals out there that would help. And of course, correcting your vitamin D deficiency and correcting low zinc and omega 3s and other immune supportive nutrients, along with the gut lining support of glutamine and collagen. That's also important, a
Yeah.
part of the long-term restoration. And because these overlap, SIBO and SIFO, with IBS, irritable bowel syndrome, many protocols combine antifungal steps with probiotics, stress reduction, careful reintroduction of fiber once the fungal load is under control. So really, SIBO and SIFO is a big part of the cause for irritable bowel.
Yeah.
And then they recommend an anti-candida diet for SIFO, low sugar, low fermentable eating pattern. And then also to limit that sugar and sweeteners, like you said. And that includes, unfortunately, honey, maple syrup, agave, high fructose corn syrup, fruit juices, and other sugary drinks.
Yeah.
Because I love my honey in my tea.
I know, but still, I mean, people do think like, oh, I'm using maple syrup or I'm using honey. Like it will still spike, your insulin. It is still a sugar. And
Yeah.
so, and same with the white bread and the pastas and the carbs and the,
Yes.
so all of those really trying to minimize and decrease.
Yep. And we know the sugar substitutes aren't good either, so we'll go into that later. But refined carbs, you all know this: white bread, white rice, white pasta, pastries, breakfast cereals, packaged goods, high mold, and some dairy products. You can see that with aged cheeses and some of the fermented dairy products, plus foods prone to mold like peanuts, old nuts, moldy grains, right? And non-starchy vegetables. You can see some of it, but you just, do the best you can. Eating those leafy greens, broccoli, cauliflower, cabbage, asparagus, onion, zucchini, and other low sugar vegetables. Low sugar fruits are your berries, blueberries, raspberries, strawberries, and small amounts of apple. with larger fruits and tropical fruits like pineapple, try to limit them. You want to eat your high-quality protein and fats, lean meats, poultry, eggs, fatty fish, and healthy fats like olive oil, avocado, coconut oil, nuts and seeds that are low mold, and that would be your almonds, walnuts, and pumpkin seeds. Antifungal herbs and spices like oregano, garlic, ginger, cinnamon, turmeric, black pepper, and other culinary spices.
Again,
So-
garlic and everything.
Yeah, garlic it may not make you smell nice, but it is very healthy for you. So, and that's how this diet fits for SIFO treatment. And, it's basically, again, changing out how you eat and doing these supports like the prokinetics, gut lining supports like glutamine, and attention to what you're eating and having more of a diet that doesn't promote overgrowth of bad bacteria or fungus. So,
Yeah.
yeah.
And again, I mean, if you step back, because I think sometimes all this can be overwhelming, it kind of is the basic, well, eat healthy,
It's the same
right?
thing,
Again,
yes.
low sugar, low processed foods, increase your veggies, so
Mhm.
all the purple
Mhm.
vegetables and fruits. So kind of, again, the basics that
Mhm.
help. So,
Yeah.
so we talked earlier briefly about, your gut biome is also affected by your mouth biome. And so I think that would be kind of a good topic to talk about, and also just chewing and how that can just have
Yes.
a big effect on that. So I guess let's just get started. And
Yeah.
how does, chewing affect the gut biome? And gut
Yeah,
health?
I'm glad you asked that because this was a recent study by the author, Dr. Rossi. She's the founder of the Gut Health Clinic in London. And so she actually at this conference gave a tip for better gut health that is useful no matter what you're putting in your mouth. She says, chew food more. So most of us in a hurry, right? How many times do you chew your food? I'm lucky if I do 5 times, maybe. Yeah, I don't know.
I used to
it's
be better, but now I have a 3-year-old and a 1-year-old, and I scarf my food.
Yeah,
'Cause I
yeah,
don't
and
know
they're
how to-
little boys, so yeah, they're hungry little boys. But not only do we start to physically break down our food in our mouths, we also have enzymes in our salivas that start to chemically break it down, and that's why it's so important for people to see that your digestion starts in the mouth. That's the first part of your digestive tract. And even chewing foods releases healthy nitric oxide agents that are beneficial for your body and your overall health. And so if you skip that process, and sometimes juicing will do that, even though you're getting a lot of concentrated nutrients, it will lose some of the benefits of this chewing.
Well, and you're also not having the fiber with
and
the
you're not
juicing.
having the fiber.
So
that's right.
That's one of the biggest.
So research shows, though, that the more chewing we are doing, the more nutrients we're coaxing out of our food, which is good for our guts. So one study looked at almonds, and they compared people who chewed the almonds 10 times, and that's a long time for me, versus people who chewed the almonds 40 times. They showed that when you chewed the almonds 40 times, you actually absorbed so much more of the good nutrients in almonds. If you only chewed them 10 times, you were absorbing a lot of it, but not getting that full kind of health potential. So chewing your food is really important for extraction of a lot of the nutrition inside into your body. However, instead of excreting it in your stool, right? However, many of us chewing more is easier said than done. There are lots of different chewing apps I wasn't aware of out there to help people chew more slowly. But what I say to a lot of patients, which is hard to do, is to just focus at least on trying to chew more, at least your first 2 mouthfuls at every meal.
Mm-hmm.
So, and I tend to, and especially if you're having dental implants placed in, you really are limiting the amount of time that you're chewing food. But anyway, you're never going to be doing 30 chews. That's very hard. Or 40 chews for sure with every mouthful. But just focusing at least on the first 2 mouthfuls might help you to get more nutrients in you each meal. And even just adding on 3 extra chews than what you're used to chewing, and the amount you're used to chewing helps with your gut health and getting nutrition in it. So try to count next time to yourself, not out loud while you're chewing your food. And it does help you. So a little simple thing there with the gut health starting in the mouth.
Well, and we also already know, chewing your food does give your body time to send the signals when you're full, right?
Yes,
so it also
yes.
helps in terms of the not
The
overeating.
hormones
So
released for saying we're going to start ingesting food.
So it's another sign that is healthier, although it is a
Yeah.
little bit hard in our go society.
Yeah.
So how would you say unhealthy like oral flora would contribute to poor health outcomes?
Okay, this was also interesting in researching it. In one study, the use of the mouthwash, like, we don't have to mention the one that they studied, but the use of the mouthwash twice a day was associated with a significant increase in systolic blood pressure after 1 week. A significant increase.
That's wild. I feel like people wouldn't know that. And it's also not, I would be surprised if a cardiologist was like, that was in their questionnaire. Like, are
Right.
you using a mouthwash?
Yeah.
Who would think
And
that a mouthwash would increase your blood
And
pressure?
we were thinking that as during COVID, that was encouraged Listerine mouthwash to decrease the viral load. But here, now, why would it do that? So then after they stopped using the mouthwash, they had recovery from its use, and it resulted in enrichment in nitrate, here we go, producing bacteria on the tongue. So nitric oxide is produced in the mouth when you start your digestion in the mouth, and that nitric oxide is so important for your cardiovascular health, and it also is a vasodilator. So that is why they think in this study, the mouthwash like Listerine and other ones wipe out that process and lower your nitric oxide production because your good bacteria are not producing it in your oral flora.
Yeah.
And that causes vasoconstriction, which causes high blood pressure. And who would know that?
That is wild. That is, I actually find that very interesting.
Me
But,
too.
I can see it, and so, like you said, nitric oxide being a vasodilator, so that means it dilates the veins, right? So you're having this dilation, which means like it basically allows more blood flow. So like, that's a lot of times what people will take sublingual nitro, if they have like cardiovascular issues and to try to open up those blood vessels in their heart to get the blood flow there. So your body makes this naturally, right? And so taking that away would then, it can cause that constriction, meaning that tightening of the vessels, which would cause, could have an effect on the blood pressure.
Yep.
So I find that interesting. I've never heard that before.
I know. And we know that beets and beetroots, those are really good nitric oxide producers that can lower your blood pressure too. So I just find that is something simple. And it would be another good study to have a cardiologist measure your nitric oxide content, before and after this mouthwash.
Yeah.
But there's also something interesting that this word called translocation. Translocation means that bacteria can move from its usual habitat in the oral cavity to a distant body site. And studies show this can happen anywhere in the gastrointestinal tract. And oral bacteria can be detected in our stool and other extraoral sites. So one of the big ones that they're studying is Fusobacterium nucleatum. Okay, so I'm just going to say fusiform bacteria. It's an anaerobic oral commensal that's important in periodontal plaques and has been linked to disease when it appears outside the mouth, and it can help other bacteria then invade tissues, bad bacteria invade tissues, and has factors associated with forming biofilm and endothelial barrier disruption. And one of the big ones here with clinical relevance is the oral to gut translocation has been observed in healthy people, but appears more common or more pronounced in patients that have some kind of disease state, including colorectal cancer, rheumatoid arthritis, inflammatory bowel disease, and nasopharyngeal head and neck cancers. So here again, this translocation of the bad bacteria to other parts out of your body, from your mouth to other parts of your body, can cause and is found in high concentration in these disease states. Now, that doesn't mean that's causality, but the association is well documented. And we see that this other bacteria, Pseudomonadata, I believe it's pronounced, are present in higher concentrations in the mouth and in the gut. And they also play an important role in producing short-chain fatty acids and boosting the growth of beneficial microbes in your intestines and in your mouth. And fusiform bacteria represent another prominent type of microbes. And while they can help stimulate inflammatory responses to fight pathogens, oh boy, they may also drive inflammation and are linked to periodontal disease. So, and we know P. gingivalis also is linked to periodontal disease, which you already mentioned is linked to cardiovascular disease.
Yep.
So we see this trend here. And firmicutes, they're another type of bacteria that tend to be particularly abundant in the esophagus. And they are finding out that, interestingly, firmicutes, which are centrally involved in glucose and insulin metabolism, belong to the phylum most adversely affected by artificial sweeteners like saccharin and other artificial sucrose, other sucralose, and other artificial sweeteners. So artificial sweeteners are worse than honey and other sort maple syrup, but I would just totally eliminate those from your diet.
I think a lot of times it's downplayed, right? So
Yes.
I think there's this whole aspect that I think people don't talk about enough in terms of how it can affect your mouth microbiota, which is so important, and then how it also affects your gut. And so, and as we are learning, in the series, that then really has such a big impact in the rest of your body, right? And inflammation and the gut-brain connection, and leaky brain, all of that. And inflammation drives inflammation, right? So if these diet, added fake sweeteners are going to mess that up, right? Then that is all part of that. It can be a part of that inflammation process. So I think that is often downplayed, when people are talking about these.
Or when people will take, the zero Coke or whatever, but thinking that it's less sugar, it's actually more harmful. But then I'll just go to this. Saliva dysbiosis was also associated with upper GI disorders, including gastroesophageal reflux and symptomatic esophagitis, which is itis, inflammation of the esophagus. And that can lead to that inflammation of the esophagus, Barrett's esophagitis, which is a precancerous cells in your esophageal lining, which can lead to esophageal cancer. And then we know it also, saliva dysbiosis can lead to this overgrowth of Helicobacter pylori, which can cause gastritis and cause atrophic H. pylori gastritis, and again, gastric cancers and intestinal metaplasia, which is abnormal cells in your intestinal tract. So much we're finding out. And two other ones were Prevotella and fusiform bacteria in saliva were associated with gastric atrophy and also with this intestinal metaplasia. So not a good thing to have these bad bacteria in your mouth either.
Well, and that's where I think, and part of the reason I wanted to bring it up is I think that a lot of people don't realize how important it is. Like, people think brushing your teeth is important to prevent cavities. And I think that that's where a lot of the education kind of stops. And even me growing up, that's really what I thought, is that you don't want cavities, right? You don't want to have gross teeth.
Yes.
You don't want to have bad breath. But, I really did not understand about, this whole bacterial system in your mouth and how it can be such a driver of inflammation, right? So not only is it affecting, the microbiota further downstream, right, which we can see in like the colon cancer risks, and we can see with the inflammation and having an effect, even on the acid production and everything. But it also has these effects on your cardiovascular risk system. And, it really, I think is very important. And a lot of people don't realize how important it is.
Yes. Yeah. And we're going to find out more and more about that too. So I just,
Well, there
it's
is. I
not
mean,
just your dental caries. It's huge on your health, and it's just important. Even this simple thing with chewing,
yeah.
But
Well, and I think that we're going to learn more about it, and just like that, there's going to be more interventions and testings, because I know at least there's a couple where you can like actually get like the bacteria in your mouth tested, so you can get like the microbiome in your mouth,
yes,
and it can like test the
yeah,
good and bad bacteria.
that's a
And
good thing to get.
I think, and again, unfortunately, a lot of these things are out of pocket, and they're not available to everyone. But I think in the future, they'll probably be able to come up with more that are more affordable and available for people. But it is at
Yeah.
least we're starting to learn more about it, and I think there's at least some tests out there, which is good.
Yeah.
That's showing that there's progress being made there. So
Yeah, and they still need to make a lot of progress in having a reliable, good gut assay, GI stool specimen, and analyzing that for your your microbiome content, because there's a lot of error in that, and it's not really perfected yet, and there can be a lot of variance showing false results. So
yeah.
hopefully they'll improve that too.
But it is cool that they're out there. I mean, even for like kids, there's now these kits where you can test their bacteria in
Oh,
there,
yeah.
and you can like see in terms of like the population how it changes. And so I'm happy that at least they're starting to be made and
Yeah.
developed and everything.
Yeah.
So I think we talked a little bit, especially when we were talking about like the SIBO and the SIFO, about how to kind of fix it. And one of the things you brought up for SIBO was this yogurt, a homemade yogurt. And I think that was in Dr. William Davis's gut health book. And so I
Yes.
kind of wanted to touch base on that because I think, it's a good intervention for people that might be struggling with this, especially, we went over the SIBO treatment and a lot of people do respond, over half or around half. Then a lot of people will get it again, right? And so I also think, not just taking the pill, right, trying to treat the underlying problem. And if this is able to help with that, I think it's good to kind of go over so that people maybe have another tool in their toolbox, right?
Yes, yes. So, again, he's Dr. William Davis. He's a cardiologist, MD, and an author of the Wheat Belly book that came out decades ago, and Supergut. And Dr. Davis' SIBO yogurt targets small intestinal bacterial overgrowth using these specific probiotic strains that have been fermented into a high count in the yogurt. And it combines strains like Lactobacillus reuteri, Lactobacillus gasseri, and originally he had Bacillus coagulans in it, but now they use Bacillus subtilis, HU58, because it had better fermentation reliability. But anyway, these, especially the Lactobacillus reuteri, these strains colonize the upper GI tract and they produce those bacteriocins. Remember, we discussed those earlier. They're kind of like postbiotics that are natural antibiotics that suppress SIBO microbes like gram-negative bacteria like Klebsiella, E. coli, and also Streptococcus, a gram-positive bacteria. So these bacteriocins are small protein-based toxins produced by bacteria, the good bacteria, to target and kill or inhibit closely related bacterial strains that are the bad guys.
Mm-hmm.
So they function like natural narrow-spectrum antibiotics, okay, these bacteriocins. And so this yogurt, high in Lactobacillus reuteri and those other bacteria that I mentioned, really help to produce high amounts of that bacteriocin, acting like a natural antibiotic. And unlike the broad-spectrum antibiotics that we use, they spare most of the beneficial microbes, minimizing dysbiosis. And in the context of SIBO yogurt from Dr. Davis, strains like L. reuteri, Lactobacillus reuteri, and Lactobacillus gasseri, they produce, again, those high amounts of bacteriocins that suppress overgrowth of the bad bacteria. So it's very interesting how he formulated it, and then he had to do some tweaking with it all. But it does help restore balance and support immunity and combat issues like irritable bowel disease or inflammatory bowel disease and infections without harming your overall good bacteria. And how do you make it? So I'm making it, And you basically take a quart of organic half and half. I get organic for sure. And then you can mix with that 1 to 2 tablespoons of inulin. That's your prebiotic fiber, remember? And that is mixed with this half and half. And then you use a starter. Now, there is a starter that you can buy called Gastrus as your starter, or you can use 2 tablespoons of your prior batch of yogurt, which is what I'm doing now. And then you stir it to make this milk slurry and put it in 2 glass bowls in your yogurt maker. And you basically ferment it at 100 degrees for 36 hours. Some people make it in their Instapot, but I have it was inexpensive, this yogurt maker. It's very easy. And then you try to consume about a half a cup daily for 4 weeks to get rid of the SIBO. And then you can cycle off afterwards, as these bacteriocins may impact, if you get too much of them consistently, they can start hurting maybe some beneficial microbes, although that's not. But anyway, you just rotate off for a little bit, and you can refrigerate your batch up to 2 to 3 weeks, and then refresh your starter every 8 generations. So anecdotal data showed that 90% people using this yogurt normalized their breath test, the H2 test, and they had symptom relief, and it outperformed that antibiotic rifaximin that GI docs often go to, and it outperformed rifaximine's 50% rate of cure. And also in patients that were treated with rifaximin, their SIBO, again, may initially resolve, but it often reoccurs. Well, taking this yogurt, it doesn't reoccur. And
hopefully.
Hopefully.
And I will
the
say,
studies aren't long-term in yet.
Yeah. And also just, to mention the study was only 30 participants, which, is a good starting point, but it's still not, a huge study. So I think it's, in terms of saying, 90%, chance of normalizing it, I think it would be great to see a bigger study.
And they are doing ongoing trials with it.
Which I think is great. But I will also say for a lot of people who, again, are struggling with SIBO and, maybe have tried rifaximin, or again, if you're even in the category where you're like, well, I'm going to be trying the rifaximin, but I know I only have a 50-50 shot. Well, maybe I'll add to this, so that it increases my chances, right? I think if you look at risk versus benefit, right, a pretty low risk profile with this, as long as you're making it correctly. And if there's possible improvement, again, this was a very small study, a double-blinded, very large study would be, even more reassuring. But I think, it's another tool in the toolbox to at least try.
Yeah.
Right. So.
Yeah. And plus a very good side effect of taking this yogurt is that it increases your collagen production onto the epidermis so that your skin has a thicker collagen content, which helps with wrinkles, ladies. And it helps with weight loss, better sleep, reduce bloating. And patients often just had an overall sense of well-being. And one of the interesting findings is this yogurt with Lactobacillus reuteri helps increase your oxytocin release. Now, remember, oxytocin in childbirth. Oxytocin is a hormone and brain chemical made in the hypothalamus and released by your pituitary gland. But it helps to trigger uterine contractions during labor, supports your milk letdown during breastfeeding, and it also plays a role in bonding relationships, which makes sense with the mother and the baby at delivery, and it plays a role in trust and social connections. So it's called the love hormone, and it is true that it really does. Oxytocin release improves your overall social connections, and so it is has that brain effect, acting as a chemical messenger involved in bonding and attachment and relieve some stress and anxiety. And again, that's why it's called called the love hormone, because the nickname comes from its links to affection and bonding, parent-infant bonding, social behaviors. And
they've actually studied oxytocin too, I think, for autism patients because of that, just because of the social aspect.
Oh, that's interesting.
Yeah.
And did it have a good effect?
For some of them, I think it's very new that they're still kind of studying it, but I mean, it's because of the social aspect, right? So
it's worth a try too. And then we know that magnesium-rich foods like spinach, almonds, dark chocolate, and probiotics in this yogurt and in kefir, these support these oxytocin pathways via the gut and brain axis and links. Also, we see some benefit from vitamin C sources, omega-3s, in producing this. But Dr. Davis' yogurt recipe is high in this particular bacteria that I mentioned, Lactobacillus reuteri, and the probiotics in his homemade yogurt help to correct small bowel overgrowth, or abnormal bacterial overgrowth in that upper intestinal tract. And that's why it's so important, because most of the probiotics we take, they just hit the lower intestinal tract, not the small bowel. And
which again, we had kind of talked about before, but just to remind people, so you have your small intestine and your large intestine, colon. And so the small intestine is broken up into these 3 parts. And so that's where it can be hard really especially with a small intestinal bacterial overgrowth, for it to get to where it needs to go.
Yeah.
And even when you're doing, we had talked about how one of the ways you can diagnose SIBO was with an endoscopy, right? And even in the endoscopy, typically, there are some where they can go a little bit further, but typically they can only get to that first part of the small intestine.
Yeah. And so that's a limit there. But, he goes into also in the book all these diseases associated with SIBO, which include rosacea, a lot of dermatologic rashes and diseases, atrial fibrillation. I did not know that SIBO could be a trigger or related to AFib. Also, restless leg. It's where you feel like you have to always move your legs,
But I will say that makes sense in terms of if you can get all these nutritional deficiencies.
Right, the iron.
I wonder if it's from...
Could be. That's what I was thinking too, yeah.
That surprised me.
Because, a restless leg can improve when you normalize your iron deficiency and B vitamins and other things. So also, SIBO is related to dementia, as this causes blood-brain barrier leakage, and it increases your amyloid B and tau proteins. Those are the inflammatory proteins, again, seen in Alzheimer's. And it's associated with fatty liver disorders, metabolic dysbiosis, and increases the release of those, bacterial toxins like LPS. So increasing your intestinal permeability measured by that zonulin. And then also, when you have the SIBO from taking a PPI, he found out in this research that PPIs not only decrease your protector, your acid from harmful bacteria in your intestinal tract, but PPIs also allow bad bacteria to descend from the mouth flora and bad bacteria to ascend from the lower intestinal tract, and then cause all of these bad bacteria to reside in the small bowel.
Yeah. And so again, some people do really need to be on these PPIs, but I think then it's good to be aware of this, because you can be, again, it's another reason to be more aggressive in terms of diet, right? And trying to make interventions that really are trying to put back in good bacteria and, kind of trying to counteract some of those issues that can come from that. So I think another thing that would be important to talk about is how the gut can kind of affect allergies. Allergies are skyrocketing now. I feel like it's quite wild. And I do think that there's a big part of the gut relationship with that we don't quite understand. And so I'm sure we're going to learn more about it. But what do you think in terms of what we know right now, how the gut kind of affects allergies?
Yeah. Really, we know that there are so much of our immune system lies in the intestinal tract. And so when you get disruption of the normal gut microbiome population and have more gut dysbiosis and leaky gut, that is a trigger we're finding out for allergies. And so the connection between gut health and allergies might seem surprising, but it's one of the most important pieces of the allergy puzzle we're finding out. And this one research published in the National Institute of Health, they say that approximately 7 to 80% of your immune system resides in your gut. So that's quite a bit. And this means the health of your digestive system directly influences how your immune system responds to everything, including your seasonal allergens. So when your gut barrier becomes compromised, sometimes referred to as that leaky gut or intestinal permeability, it allows partially digested food particles and toxins and other substances, again, to escape into your bloodstream, which we have already discussed. And then your immune system recognizes these as foreign invaders and mounts an inflammatory response. And over time, this creates a state of chronic low-grade inflammation that leaves your immune system on overdrive, overactive, hypervigilant. So the gut health and allergen connection operates through several mechanisms, but your gut microbiome, the trillions of bacteria living in your digestive tract, they play a crucial role in training your immune system to distinguish between genuine threats and harmless substances. And when this bacterial community becomes imbalanced in gut dysbiosis, your immune system loses its ability to respond appropriately. It loses its discernment, if you will, and instead of ignoring benign triggers like pollen, it launches a full-scale allergic response. So that's something new too.
And I honestly think that there's going to be more that we find out about this. I
well,
think
like the histamine release.
Yeah, I think, again, the body is a whole. And so I think, you can't say, oh, the gut is the only part of this, right? I just think that it probably does play a part and that we don't fully understand that. And I think that we'll learn more about it.
Yeah. Or at least we would say it interferes with the normal regulation of your immune system.
Yeah.
So
we have discussed the importance of small chain fatty acids a little bit, especially in the first podcast.
Mm-hmm.
But I thought that we would maybe go into that a little bit more, especially butyrate.
Oh, yeah, because butyrate's beauty. Okay, so...
and I think also just to recap maybe where short-chain fatty acids come from.
Yeah, I think that'll be good, and we can do it with this butyrate. So butyrate, again, remember, short-chain fatty acid produced when gut bacteria ferment dietary fiber. And the healthier your gut flora, the more amount of butyrate you'll produce. And this butyrate provides energy for your colon cells and offers health benefits beyond basic nutrition. So research suggests butyrate helps manage these inflammatory bowel diseases by reducing inflammation and, again, strengthening the gut integrity from leaky gut. Lab studies show butyrate helps inhibit also cancer cells in the intestinal tract and inhibit cancer cell growth and triggers cell death in colorectal cancer cells. So that's interesting clinical trials that they're doing with butyrate. Butyrate, of course, has been shown to improve insulin sensitivity and glucose metabolism for metabolic disorders, and it influences appetite-regulating hormones like GLP-1. That's a natural hormone in your body, and butyrate helps to influence the amount of that hormone. Studies show butyrate protects against neurodegenerative diseases by reducing brain inflammation and enhancing neuronal repair and survival. And then human metabolism evolved around the butyrate GLP-1 connection long before pharmaceutical companies developed GLP-1 agonists like Ozempic. Our ancestors ate diverse, that's the key, like you mentioned, diverse plant fibers that fed gut microbiomes, which turned out and churned out in high amounts butyrate. And that butyrate kept the intestinal barrier strong, inflammation low, and appetite hormones in balance. So it caused, the appropriate satiety when you had a big meal. Today, processed foods and industrial seed oils, especially vegetable oils that are high in linoleic acid, break that cycle and they damage gut bacteria, slash butyrate output, and disable something called the L cells that are responsible for natural GLP-1 production. So could that be a reason why we have so many people that are overweight? They don't have this balance.
Yeah, and I could definitely see how that would contribute. Because, if you think about like a regular bag of chips, right? So you're going to get like all the seed oils, plus you're going to have all of the bioengineered chemicals that they're putting into it to try to increase the dopamine so that then you're addicted to them. So not only are you going to mess with this whole process that like tells you you're full via the GLP-1 system where it's decreasing your body's actual like natural ability, you're also having the mess with your brain from what they're putting in the food to tell you, hey, you need more of this dopamine hit.
Yeah, addicting.
And so you're getting it like in two ways kind of that are telling you,
true.
Hey, you're not full, you're super hungry, you need to keep eating this. So
and so then you get people that are tired, inflamed, and overweight.
Yeah.
So butyrate nourishes, as I mentioned, these L cells in your intestinal lining, the same cells that release GLP-1 hormone after you eat a meal. And when butyrate is abundant, this GLP-1 hormone secretion works the way nature intended. and it slows your gastric, that GLP-1 agonists, even the pharmaceutical ones, we know they work by slowing gastric emptying, so you have early satiety. You feel full for a longer period of time after eating. It reduces glucagon, which lowers blood sugar. It enhances insulin sensitivity and helps your body burn fat. And it sends satiety signals to your brain, which is what you just mentioned, curbs your cravings and emotional eating. So we know butyrate has been linked to so many health benefits in supporting the integrity of, the gut lining, getting rid of bad bacteria, fighting cancer, promoting inflammation, protecting against this obesity and diabetes, and because it can also function as a prebiotic in helping beneficial bacteria thrive. Recent studies have linked an abundance of butyrate-producing bacteria with reduced bone fractures and hospitalizations for infectious disease. So butyrate, that is pretty significant if you can decrease your... Now, they didn't go into in that study if the bone fractures were from, having osteoporosis from poor diet and gut health. But anyway, it wouldn't surprise me if that's how it reduces it, butyrate. But microbes in your colon can convert the amino acid tryptophan, that's in your turkey, that makes you sleepy, right? Also, it's found in animal-based foods, and what it can do is the microbes in this colon can convert that tryptophan into neurotransmitters like serotonin and melatonin.
Yep.
And the enteric nervous system in your gut, this nervous system around the gut, is immense. And the gut-brain axis has become a very fertile area of research. Lesser-known tryptophan metabolites like indole, tryptamine have been linked to benefits like fortifying the gut bacteria, promoting the release of GLP-1 peptide, and reducing appetite and protecting your liver from hepatitis. So,
well, and I think it's interesting. I think it's almost 90% of your body's serotonin is actually made in the gut.
yes,
So
yes.
I think that people don't realize, and that's it
We
plays a huge function in
yeah.
so many things, right?
Yeah.
Not only your melatonin production, but serotonin on its own is needed for so
Yes.
much. So
Yeah. And we know that butyrate is also your primary energy source for your colon cells and these colonocytes that line your colon. It provides up to 70% of their energy needs, and its benefits, again, go far beyond just fueling those cells. It also reduces, again, the immune system. It also reduces inflammation and improves your immune system. But individuals with this inflammatory bowel disease often experience a double hit because they have a decline in butyrate-producing microbes, and they have a diminished ability to utilize butyrate effectively. For all of its benefits. They also have reduced expression of butyrate receptors in the colon, which hampers the butyrate uptake and causes more inflammatory cytokines like tumor necrosis factor and reduces butyrate oxidation. So it's a lot of problems that you see related to this decreased butyrate production and appropriate use in people with inflammatory bowel disease. It has been shown, interestingly, though, to inhibit growth of cancer cells and trigger actually apoptosis or programmed cell death of cancer cells, helping them to stop cancer cells from multiplying. So butyrate's ability to affect gene expression in cancer cells by specifically turning off genes that promote cell growth and turning on genes that promote cell death. So it has an epigenetic effect there. Butyrate is also an effective complementary agent in cancer therapy because of its ability to enhance the efficacy of chemotherapy and radiation therapy has been documented in preclinical models. And butyrate improves how your body responds also to insulin and regulates sugar and metabolism, mitochondrial function. So it really is coming out to be more than just another small chain fatty acid.
yeah.
I think it's a super duper one that will really help us.
Yeah. No, I mean, I think that that's super interesting. I think, especially like for, people who have been diagnosed with cancer or have overcome cancer in the past, I think that the diet relationship to treatment, I think, is something that a lot of people are very interested in and that we're learning more about, and even New England Journal of Medicine just had an article that came out on diet and, different cancer treatments and outcomes and, how sometimes they can be like an adjunct, meaning like helpful, but there's so much to learn. But you do wonder if some of that, has to do with this, like the butyrate and, all of this healthy bacteria and setting up your gut, if it has an effect. I think it's something that we'll definitely learn more about.
Yeah, it's important to know about it because if you have a low concentration of butyrate from an unhealthy diet and unhealthy gut flora, that could be also, if you look at it with low concentration butyrate, then you lose that protection and you're more likely possibly to develop cancer. So
right. Again, the healthy diet, it does decrease inflammation. Inflammation also it plays a role in that.
Yes,
so
absolutely.
There's just so many different factors. I think something else to get into, because, obviously at Duration Wellness, we're very big on sleep. Sleep affects so much. It's if you're sleep deficient, right? It drives inflammation, drives cardiovascular risk, drives, diabetes, pre-diabetes, insulin resistant. I mean, I could just keep going with the list in terms of how important sleep is, which is the whole reason why we developed Sleep Club. But I think we should also definitely talk about, probiotics and gut health and like the effects on sleep.
Yes. So this is interesting because most of you may have heard, maybe not, about the GABA and glutamate system in our body. GABA and glutamate, they act like the brain's main brake and gas pedal for sleep. That's a good way to look at it. So glutamate for sleep and for wakefulness. So GABA is the one that is our main inhibitory neurotransmitter and generally promotes sleep, sedation, sleep maintenance, while the glutamate is the main excitatory neurotransmitter, and that supports wakefulness and arousal and can be a big troublemaker if you have too much of it when you're ready to go to sleep. So sleep is not just about more GABA or less glutamate. It also depends on the right balance and the timing of both systems across your sleep-wake cycle. So the best way to support the relaxing, sleep-promoting GABA is with food-based prebiotics taken at the right time, which is at bedtime. So that's prebiotics like we discussed, inulin and fructooligosaccharides and aspergillus-derived enzymes. Anyway, basically these prebiotics that increase your brain GABA and then this homocarnosine compound that protects and stabilizes brain function. So GABA, good to go to sleep, glutamate, not good. And your prebiotics help your GABA to be increased, production to be increased when you want to go to sleep and rest and get a good night's sleep. So we know that specific gut bacteria such as Akkermansia and Parabacteroides were directly linked to higher GABA concentrations. And prebiotic foods that specifically support GABA-producing bacteria are your bananas, asparagus, garlic, and leeks. And fermented foods like kimchi, kefir, and miso, they contain small but meaningful amounts also of GABA. But, I remember always eating a banana before I went to bed. Now I don't do it because I do timed restricted eating. But
I do think, it's important for people to know that they can kind of have those effects. I will have the caveat of, we do know that the later that you eat, your gut also has like a circadian rhythm, right? And so you aren't supposed to eat very late at night. That actually can interrupt your sleep. But I do think, having these at dinner time, a few hours before you're going to go to bed, so probably with the recommendation, not that somebody would have a banana right before they go to sleep, but, maybe at dinner time, a few hours before you're going to bed, just because, again, the late night snacking, it is actually a reason that people can sometimes have decreased sleep quality. But again, the body as a whole, and there's so many factors. So it's so interesting.
Well, also we know some of the other supplements that may help are L-theanine, magnesium, ashwagandha. They boost your GABA activity and they also help to decrease your cortisol, your stressor hormone that a lot of time is on overdrive when we want to go to sleep.
Yeah.
So they have been shown to also help and improve sleep.
They have, which is why that's actually the L-theanine and the magnesium are also in the Sleep Club because, of all the findings with that, which, again, trying to help your body get into that relaxed state, is a big part of, sleeping well.
Yes, so. and lowering that cortisol, that they do that. And And sometimes women will find natural progesterone, micronized progesterone helpful also to lower the cortisol level, the stress hormone. But if that's elevated when we're in this hyperarousal state, like we discussed in our first podcast, it's so difficult to get to sleep.
Yeah. And I think that people don't realize, in our society, it's very common the go, 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 right? You have 10 million things to do. And then a lot of times the only time that people are processing their day is when they're actually trying to go to sleep. And that's not
the time to do it.
That's like the last time you want to be doing that. So, and then you're thinking back to, I forgot this, your stress level starts increasing, right? And it just can be this vicious cycle. So supporting
that's why that cognitive shuffling that we discussed too in the earlier podcast, where you take a word that say barn, and barn begins with B, then you think of all the nouns that begin with B, and while you're thinking of that noun that begins with a B, like bat, you're going to visualize a bat also and put it under that B category. When you run out of nouns for B, then you go to the next letter for barn is A, and you think of all the nouns that begin with A, and usually by the time you are on the third letter, this cognitive shuffling has rebooted your thoughts, so you're not stressing out about it. You forgot to do this today, and what do you got to do tomorrow? It kind of just puts them in a category of focuses, so you get sleep.
Yeah, so that you're not your brain isn't racing as much, So I think that's. I mean, again, sleep is very complex. There's so many factors. We're mostly focusing on the gut part here, but supporting it with the L-theanine and the magnesium can help for a lot of these people who have these kind of overstressed, cortisol sort of increased state that can kind of be affecting it. So
the other thing, interestingly enough, that I started using are like we use for CPAP machines are these chin guards, I guess you could call them. But basically you wear them. They look really like a wrestling, like you're going to wrestle somebody, but they basically keep the mouth shut. So when you're sleeping, when you sleep and with an open mouth, that can be a trigger to wake you up because it startles your body with the open mouth and the dry mouth, and it stimulates your sympathetic nervous system and your stressor hormones. And so you wake up often through the night because of this dry mouth. But just having it here and making sure your nares is clear for breathing through your nose, that has also been beneficial for sleep too. So
I wonder if some of that is, some people have, sleep apnea that's undiagnosed. And so sometimes just having that little bit of pressure in some of the systems can help. So
could be also.
But I mean, a side note that would help at least, when you're sleeping with an open mouth, that is not good for your oral microbiome. So it actually is a driver of all of the bad bacteria in your mouth.
Which can cause all those bad
problems. Then can cause all the issues downstream with your gut. So another way that can kind of affect at least the gut process of sleep and everything. So
very true.
Yeah, so this was so interesting. I think we covered a lot,
I think we did. And
as always, this is not medical advice. This is just for educational purposes only, but I think this was a fun series. I'm sure it's just the tip of the iceberg. There's more and more that's coming out every day. But
this was,
basically
54 pages of notes, and you could have had triple that.
Yeah. But I hope you enjoyed it, and hope you come back for another episode.
Okay, bye.
All right, bye.
Thank you for joining us for the Duration Wellness Show. We hope you feel equipped to apply today's science-backed insights to your daily life. To find show notes, past episodes, and all the resources we mentioned, visit us at durationwellness.com. As always, this podcast is for informational and educational purposes only and does not constitute medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect those of the host. We'll see you next time, and as always, we're here with you for the duration.